Hello everyone. Today we are going to discuss another set of one-liners in pediatrics. To start with, what is triad syndrome? Interestingly, it is same as Eagle-Barrett syndrome or prune-belly syndrome. We know about Eagle-Barrett syndrome. We know about prune-belly syndrome, but this is the other name is your triad syndrome. The components are deficient abdominal muscles, undescended testes, urinary tract malformation in the form of viewer and megalourethra. So we have to remember all the three names. Triad syndrome is equivalent to your Eagle-Barrett syndrome, is equal to your prune-belly syndrome. Next, what is the dose of vitamin A needed to be given to a 10-month-old baby as per vitamin A prophylaxis program? The answer is 1 lakh unit. To add something, the dose of vitamin A less than 6 months baby, if you want to give vitamin A, it is 50,000 IU. If infant is 6 to 12 months old, then the dose is 1 lakh international unit. If it is more than 1 year old, then the dose is 2 lakh IU. In measles, we are giving generally 2 doses in order to prevent complications, and whenever there is a vitamin A deficiency state, then vitamin A should be given 3 doses, day 1, day 2 and day 14. Next to know what about WHO classification of xerophthalmia. As you know, there are certain class stages, your 1A, 1B, 2, 3A and 3B. 1A is conjunctival xerosis, 1B is bitter spot, 2 is corneal xerosis, 3A when corneal ulceration involving less than 1/3 of cornea, it is termed as 3A. 3B when we can say if the ulceration involve more than 1/3 of the cornea. Then next is X, N, F and S. N is night blindness, F is fundal changes and S is corneal scarring. So we have to know the WHO classification. Then rapid correction of sodium in a case of chronic hyponatremia can cause which significant disease? The answer is central pontine myelinolysis. As you know, in chronic hyponatremia cases, the brain has got adapted to this condition by extraction of your intracellular electrolytes. So rapid correction, that is what do we mean by rapid correction? If the correction is by more than 25 milliequivalent per liter in first 24 to 48 hours, then it can cause central pontine myelinolysis. The clinical feature would be mutism, dysarthria. It can present either with spastic quadriplegia, even can present with pseudobulbar palsy or even seizure. So we have to be very, very careful while correcting the sodium level in a case of chronic hyponatremia. Next question, triad of Wiskott-Aldrich syndrome. The triad is eczema, thrombocytopenia and recurrent severe bacterial infection. To know something about Wiskott-Aldrich syndrome, it is one of the excellent recessive disease. The mutation encoding the WAS protein. Here what we get? You will get recurrent bacterial infection, thrombocytopenia and eczema. Thrombocytopenia with small platelets. Here we have to remember what size of the platelets will be small platelets, and there will be increased risk of lymphoreticular malignancy. Next question, how many doses of HPV, human papillomavirus vaccine, to be given to a 10-year-old girl as per IAP? HPV vaccine, as we know, vaccine either bivalent or quadrivalent. 2 types are there. Bi means 2 serotypes are covered. It is 16 and 18. Quadra means 4 serotypes are covered. That is 6, 11, 16 and 18. Catch-up vaccination wise, as per IAP, if the age of the girl is between 9 to 14 years, then 2 doses. 2 doses is sufficient. 2 doses, how to give? 0 and 6 months. And if the age is more than 14 years, then dose would be 3 doses. Then it could be either 016 or 026 as per the vaccine which we are giving. If you are giving bivalent vaccine, that is Cervarix, then dose would be 0, 1 month and 6 months. If it is a quadrivalent vaccine, that is Gardasil, then dose would be 0, 2 months and 6 months. So you have to remember 016 or 026 and less than 14 years 2 doses 0 and 6 months of 2 doses 0 and 6 months HPV vaccine. That we have to remember. Next, which disease is known as 100-day disease? Answer is interesting. That is pertusis. Pertusis is known as 100 days disease. It is named by the Chinese people. To know something, Bordetella pertussis is the causative agent. It is the gram-negative coccobacilli. It is divided into catarrhal phase, paroxysmal phase, and convalescent phase. And drug of choice is macrolides. Macrolide group, like that is your erythromycin, azithromycin. These are the drug of choice for pertussis. Next, Charge syndrome. C stands for what? C stands for coloboma. Usually the mistake what we are doing in exam, C stands for choanal atresia. This is the usual mistake that everybody, mostly not everybody, but we are doing. But here the trick is C stands for coloboma. Coloboma for eyes. Then H, heart disease. A, atresia of choanae or choanal atresia. R, retardation in growth. G, genital abnormality. And E, your abnormality. Ear abnormality, where you can get ball shaped ear or concave ear. So Charge syndrome, C stands for coloboma. Then name the, looking at the photo, we have to name the disease. We can look here, we can what we can observe, the macroglossia, your rough skin, your umbilical hernia, and the look itself. The answer is evident. That is, it's a case of congenital hypothyroidism. To add something, it is the congenital hypothyroidism is the most common preventable cause of mental retardation. The most common cause of congenital hypothyroidism is thyroid dysgenesis. The clinical picture wise, we can get open posterior fontanelle, your umbilical hernia, coarse facies, protruded tongue, hypotonia, hypothermia, and prolonged neonatal jaundice. Any newborn who presents with prolongation of a neonatal jaundice beyond 2 weeks, here congenital hypothyroidism has to be ruled out. The screening program, newborn screening program, we are usually doing TSH. TSH, usually it is done after day 3. Why after day 3? Because either you send the TSH from placenta itself or after day 3. Because there will be a TSH surge. TSH, why TSH? Because labor is a stress process. To any stress, there will be an autonomic storm-like phenomenon. So there will be a TSH surge, and it will take 40 to 72 hours to settle down. So if you want to send TSH, we have to send after day 3. Then dose. How to give thyroxine? The dose is 10 to 15 microgram per kg per day, and it has to be given lifelong. This is important. Not for 3 to 5 years. It has to be given lifelong, and it has to be given in empty stomach daily. Next question. It is a clinical case. A girl child with right-sided focal seizure having typical facial lesion as shown in the picture, and typical CT finding involving calcification. So what is the name of the disease? It is evident the face, the left half of the face, the picture is what we can see is your potent stain. Potent stain, P is persistent. P stands for P. Potent stain, it will persist, and your CT, it is involving left calcification in the left skull, left brain, and what we are getting, what is the name? The typical name is called tram track or rail track calcification, and the disease is your Sturge syndrome. Sturge syndrome. So it is one of the neurocutaneous syndrome. Then somebody can ask, what are the other neurocutaneous syndrome? You can start with your neurofibromatosis, your Vallejo Lindow, your tuberculosis, your Sturge syndrome, your incontinentia pigmenti, and your face syndrome. These are the neurocutaneous syndrome. And what are the clinical picture? What you will get typically in Sturge syndrome? Your potent stain. Potent stain, P will persist. P for P. Your glaucoma you can get, and CT wise you will get tram track or rail track calcification in the same side. That is to be remembered. The site where you can get potent stain, in the same side you will get the calcification, and the seizure where you will get opposite side. Definitely. So if some lesion is there in that side, then opposite side you can get the seizure. So focal seizure in opposite side of the potent stain we will get. This we have to remember. Next, identify the disease. We can see the ECG paper. What we are getting, though many things are there, but what we can, if you observe closely, the PP interval is constant. PP interval is constant, but some QRS is missing. QRS complex is missing. Then what is the disease? Definitely it is congenital. This is heart block. Then what type of heart block? Either it is first degree, second degree, or third degree. What we will get? This is a second degree heart block. Then how to know first degree, second degree, or third degree? In first degree, only there will be PR prolongation will be there. Second degree, PR prolongation gradually it will increase, and your second degree heart block again two types, 1 and 2, Mobius type 1 and type 2. In Mobius type 1, gradually the PR interval will increase, and again sometimes your QRS will be absent. Gradually PR interval will increase and QRS will be absent. That is type the Mobius type 1 of second degree heart block. Type 2 is your QRS will be absent, PR will be P interval will be constant, but at some time your QRS will not be following the P wave. So that is called your type 2, Mobius type 2 heart block. When P and Q, they are totally, there is atrioventricular dissociation. That is P and Q, they don't similar. Sometimes P will be there, where Q will be there, QRS will be there. Then that is called your third degree heart block. So that's all for today. Please like and share this